That concludes questions to the Minister. We have an urgent oral question from Cara Hunter to the Minister of Health. I will remind members that if they wish to ask supplementary questions, they should rise continued in their places. The member who tabled the question will be called automatically. Clerk, please read the question.
To ask the Minister of Health for his assessment of the impact that funding cuts to Nexus NI will have on the delivery of specialist counselling services for victims of sexual abuse.
Call the Minister of Health.
Speaker, I want to reassure members of my recognition of the absolute importance of sufficient specialist counselling for victims of sexual abuse. I can advise the Assembly that Nexus was awarded a 3-year contract in April 2019 to provide a specialist counselling service for victims of sexual abuse, with an option for 2 one-year extensions. The second of these extensions ceased on the 31st of March 2024. My department has been in communication with Nexus over many months in connection with the contract and has worked extensively with them to improve waiting list times and the standard of service being delivered. Unfortunately, significant performance and operational issues have been identified in relation to the delivery of this contract. I should clarify that these largely relate to efficiency and lower than expected numbers of sessions rather than the quality of the counselling that is being provided. The areas identified of underperformance include the number of counselling services provided, with a projected 24% gap for this year between the contracted sessions and the total delivered. To put that in perspective, on the current trajectory, that is over 4,000 fewer sessions being delivered than expected, and considering the need and demand for such services, this is something that does cause real concern. My department has been examining potential alternative arrangements following the conclusion of the Nexus contract. A number of options have been identified, including the provision of support by the community and voluntary sector, or health and social care trusts, or primary care. However, having discussed the situation with officials, it is clear to me that further work is required on mapping out future sustainable arrangements. Speaker, in that case, I have therefore instructed that the Nexus contract be extended for a further 12 months, with close monitoring of performance throughout that period. Whilst there may be some deep concerns about the broader delivery of the contract, equally, I am not prepared to tolerate a position whereby new victims and survivors had no service at all come April. This 1-year extension will allow proper consideration, decision and implementation of the best way forward for counselling services of this nature. I should also advise members that the planned ending of this contract was not a cost-saving measure. The intention has always been to use the available funding to continue to support people who are victims and survivors of sexual abuse, in line with the draft Domestic and Sexual Abuse Strategy 2330. A priority has been to ensure that clients currently in receipt of counselling services would continue to receive them after April 24, and my department has been involved in detailed discussions with Nexus to make the necessary arrangements. This was intended to ensure that anyone currently in receipt of counselling or who has had an initial assessment will receive an appropriate service from Nexus. However, that still left a potential gap in provision for new people coming forward for counselling, and I believe that the 1-year extension that I have announced today addresses that concern.
Thank you, Mr. Speaker, and I really welcome this, Minister. That's really fantastic news. Over the weekend I spoke at length with survivors and victims of sexual violence, and understandably it was very triggering for them. How can we make sure that this never happens again, where there is that gap? How can we make sure that that never ever happens again?
Sure.
I think that is the question I have asked of departmental officials in regards to how this was being managed in regards to identifying those alternative pathways to ensure that no woman come the 1st of April was left without some protocol and without that support mechanism. So that's why I've taken the decision and directed that this contract be extended for 1 year, with the caveats that I gave in my initial answer.
Thank you, Mr. Speaker. Minister, this was originally a 3-year contract. It's been extended now twice and now a third time, which very much welcome. But how is it that we found ourselves in a position that Nexus is contacting MLAs with less than a month to go to suggest that this is going to come to the end? Has your department not been engaging over the last 2 years of extensions to try and ensure that we have a proper service that's in place that does perform well?
My officials have been engaging extensively with Nexus in the past few months as we approach the end of this contract to ensure that those who are already engaged with the service received the support that they needed. I think the challenge was the identification of who would take over in regards to that support and provision, because, as I said, Speaker, in regards to this wasn't about funding. This was about ensuring that we had the appropriate support and mechanisms in regards to that. In regards to the conversations between my department and the SPPG and Nexus, they have been looking towards how we actually addressed in the last 2 years that underperformance that I initiated and spoke about earlier in my initial answer.
Linda Dill.
Mr. Speaker, and I thank the Minister for his answers. And I reiterate the words of Cara Hunter. This is very, very welcome news because, like herself, I met with a number of people who are survivors of sexual violence who required the services of Nexus, and some of them who didn't get any services because there weren't any there, and that's what we want to ensure never happens again. So I think, just in the same vein as Ms Sugden's question, if we can get an understanding of how we're going to be kept updated on what is going to be put in place, whether Nexus are being given an opportunity to improve that performance or deal with those performance issues, because we need to ensure that at the end of this year we're not in this position again.
Minister.
And I think that's, I thank the member for that point, because I think that's crucial in regards to my announcement in extending this contract for a year. I do want to see those improved services and delivery that my officials have been engaging with Nexus over the past few months in regards to make sure that we close the gap of what we expect, what we're paying for, and actually what is being delivered. And just in regards to that, and I've asked my officials actually to engage with Nexus to make sure there is a regular monitoring update in regards to how that new contract is taken forward. I will say, Speaker, just in regards to that, unfortunately this will be the first time I think that Nexus may be made aware of this, because I wanted to give this House the opportunity to address this in this urgent order.
Going forward, what will be the wider impact felt by his decision on contracts relating to other departments, for example Justice and the PSNI, and what consideration did and will he give to those factors?
In regards to that, this specific contract is one that is held with SPPG and my department in regards to that support, and that's why I felt it was within my gift to extend it for the year. That's the direction and the advice I have been given from my officials. If the member knows different, I'll follow up with her later.
I thank the Minister for coming to the House today. It's excellent news that this has been extended for 1 year. Just for clarity, I have been speaking to victims and survivors of abuse over the weekend, and the impact and the need for these services is absolutely essential. Can you please confirm that everybody on the waiting list will be able to access counselling this year? And can you confirm that moving forward this won't be handled this way again? People who are on this waiting list have been devastated at this announcement and have been extremely stressed at the way it's been handled.
I think in regards to the waiting list for the provision by Nexus is one of those issues that has been discussed extensively with my department officials and Nexus to make sure that everyone who is on that waiting list receives due and timely support, as is the contract, and that's what we want to do, and working in partnership with Nexus during the next extension of 12 years, while a further scoping piece of work actually takes place in regards to what the service looks like at the end of that time, but also who provides it as well.
Mr. Speaker, and Minister, like everyone else in this House, we will be relieved and gladdened to hear of this extension for Nexus. I think what worried most of us was the loss of such a specialist service for people who have suffered in such a violent and terrible way. And can you assure the House that going forward we will not be thinking of putting people who have suffered rape or violence onto general mental health lists, because I think that this would be the worst outcome that we would have. We really do want to see the department and yourself build up this very specialist advice and help for people who have suffered.
Yeah, and I think that again the member makes that valid point, and as I said, having discussed the situation with officials this morning, it's clear to me that further work is required in mapping out future and sustainable arrangements, so we can make sure that support and guidance is there in regards to what is needed, and that 1 year extension will allow that proper consideration, decision on implementation of the best way forward for those counselling services of this nature.
Minister, for your answers so far, and thank you for the extension. I'm sure that service users, those specifically on the waiting list, will be glad to hear that. But what does concern me here is that a few things have been said. I mean, members of this House were informed that there was a tendering process that had been started but then was paused. If it was not about financial reasons and instead operational, why then was that paused rather than sitting down with Nexus to actually discuss these issues, to actually get to the bottom of that? What was that, your decision or a decision of the SPPG, and what can we do to ensure that that doesn't happen moving forward, that we actually have solutions rather than simply cancelling a service?
I think the member, and I'm sure she will be aware that she has the update in regards to the tendering process. It was paused before my time in regards to that decision being taken, but there was and there has been continuing ongoing engagement with Nexus in regards to the current provision of what is there, and I look forward to working with them in partnership in regards to this next year to make sure the service delivery meets the needs of the women who are actually presenting to the service as well in that future, but allows my department and SPPG to do that further piece of scoping work in regards to what actually is required in mapping out a future and sustainable arrangements.
Alan Chambers.
Mr Speaker, Minister, has the lack of an executive over the last 2 years contributed in any way to the current situation that we find ourselves in with Nexus?
No, and I think the member for his point, and I think I'm back to Ms McAllister's point in regards to when the contract was actually paused or the procurement was actually paused. In regards to that, those decisions were taken without ministerial input. I think today shows the advantage that this place has when concerns are raised in this House. Ministers can actually intervene and implement in regards to what needs to be done, but also taking into consideration those monitoring arrangements that we do need to put in regards to this contract over the next 12 months.
We now return to the debate on executive reform. The question was first put on the motion before question time, and the Assembly was not in agreement. Clear the lobbies. The question will be put again in 3 minutes.